The long walk to the operating theatre, feeling well enough, in fact, to walk. But Ian Whedon has been told that without this surgery, his condition will only deteriorate.
Right, you know what you're here for this evening?
Yeah.
Tell me in your own words.
Oh, sorry, liver transplant.
Perfect.
This is not where he expected to find himself. Who would? The team at the Royal Free Hospital in North London prepare the donated liver. On the other side of the curtain, they prepare him. Mr. Whedon was told 3 years ago that his liver was scarred. Years of social drinking had led to this.
Because it's a very big operation, the risk to his life, he has about anywhere up to 10% risk of dying from various complications throughout the recovery, not immediately usually. And of course there are lots of risk complications with big surgery like this.
The Channel 4 news team had been allowed to film this as part of a drive by the European Association for the Study of the Liver. It's to highlight the astonishing rise in the disease of this often forgotten organ. In the UK alone, since 1970, deaths due to liver disease have increased by 400%. This is in stark contrast to diabetes, heart attacks and cancers, which have largely flatlined or decreased. Every day, more than 40 people die from liver disease in the UK, and it's the third leading cause of premature death, yet 90% of liver disease is preventable. For all the incredible advancements in liver transplants and the treatment of liver disease, the bottom line is the staff here tell us they would rather patients weren't ending up on these wards, and that means better prevention and better government policies. It's not just alcohol-related liver disease that's on the increase. 1 in 4 people worldwide now have non-alcoholic fatty liver disease driven by obesity and poor diet.
Here's the eating mess. Anyone fancy some?
In May, the celebrity chef Jamie Oliver protested at the government's delay on banning buy one, get one free junk food deals. The government also appeared to reject the idea of a salt and sugar tax.
We need awareness, but until awareness kicks in, government interventions are key. We had this policy in Scotland where there was a tax on alcohol, and it was like a natural experiment because there was a tax in Scotland, but not in England. And the deaths and admissions from alcohol in Scotland greatly reduced compared to England, where they stay the same or increased. And apart from that, we should ban junk food ads from the television. We should discourage people drinking sugary drinks.
The liver sits here under your ribs, okay? So it's next to your stomach.
This is a form of prevention. Liver specialists attending a nearby conference in East London popped into Calverton Primary School to talk to 10 and 11-year-olds.
A liver transplant's a very inexpensive way to treat someone with liver disease, whereas educating youngsters or young people about alcohol and diet is a much more efficient and cost-effective way to prevent liver disease and to improve general health.
It's like the engine. So, in a way, when you think...
Where once it might have been a discussion on smoking and lungs or looking after your heart, this was a quick-fire lesson on an entirely different, and let's face it, not often discussed organ.
I learned that the liver is the most important organ in the body, and that if the liver is damaged, a lot of things won't be working in your body. It says keep healthy so your liver can keep driving.
How are you feeling?
Yeah, I'm feeling very well, thank you, yes. Yeah. Remarkably well, as the surgery was only a week ago.
When you look back at your lifestyle, did you ever think, oh, I'm drinking too much, or this is bad for my liver?
Not at all. Not at all. Unless, I had that call at that time telling me those things, my lifestyle probably wouldn't have changed because I didn't feel like it needed to. I didn't feel ill. I didn't feel like I was controlled by alcohol in any way, shape or form. I just thought I was a heavy social drinker. And when you start actually examining how much you drink yourself, just because you're clever, you can have 3 days off, or so what? On the other 3 days, I made up for the 3 days I was off.
Mr. Whedon's recovery is impressive. Apart from the silent damage he'd done to his liver, he was relatively fit, and that helped. But now his life has changed, and he told us that he has been given a second chance.